So this is the so-called Touchstone program. This is ulcerative colitis, again, not Crohn's. And it's very typical of what we normally see in a trial, right? And I'll go through this in terms of trial design one time, and then we'll kind of go quickly through the other trials. So oftentimes, patients get randomized. They'll get placebo, half a mg, or 1 milligram per day. 8 weeks, which, again, that's very standard in clinical trials. For us in the audience, that's really an artificial endpoint. It has to do with placebo effect. It has to do with, what we call induction, and do we see a significant benefit. But I can't remember the last time, short of an adverse event, that with any medication we said at 8 weeks, go ahead and stop. This isn't going to work, right? So we usually go longer clinically. As in most trials, you're randomized, and you reach a primary endpoint at 8 weeks. If you haven't responded in this trial, you're able to go out onto open label, so sort of a compassionate use. Let's give these patients a try, because they might have been on placebo or the lower dose arm. If you do respond, you stay in your respective category, and that's the maintenance arm of this. And again, very standard in most of the ulcerative colitis trials. We use the Mayo score, and you have to have an endoscopic score, so there's an objective measure there, and most of these patients are allowed to remain on aminosalicylates or prednisone. They weren't allowed to remain on biologics or immune modulators.